Hi, David Rosenberg here for the Psychopharmacology Institute. In this child and adolescent psychiatry Smart Take, we'll look at a recent report examining whether SSRI treatment in children and adolescents is associated with increased risk for type 2 diabetes. We know that a lot of concern has been raised about risk for diabetes, other metabolic disorders for patients treated with other medications, particularly the second generation antipsychotics. And we also know that children and adolescents may be at especially increased risk. But we know a lot less about other psychotropic medications commonly used in children and adolescents. And there has been this association between SSRIs and type 2 diabetes reported in adults. But as so often happens, children and adolescents remain the diagnostic and therapeutic orphans and are often not studied or understudied. Well, here, what's nice is that there's a very good study that is done, and the authors really do a careful deep dive look at whether SSRIs are associated with type 2 diabetes in children. And also, I think this is a real interesting part of the study. They look at differences between particular SSRIs. So is fluoxetine more or less favorable or more or less of a risk than sertraline or any of the other SSRIs? So here, the authors examined real-world data of children and adolescents 10 to 19 years of age with a diagnosis where one would use SSRI treatments such as depression, anxiety, OCD, PTSD, panic disorder, and bulimia. They examined two nationwide healthcare databases consisting of claims from Medicaid and privately insured children. And what they found was that SSRI treatment was associated with a very small but statistically significant increased risk of type 2 diabetes in publicly insured but not privately insured children. So overall, the absolute risk in particular was found to be quite small, and so small that it's not even clear that this was a clinically significant difference. This may have been statistically significant, but not have had clinical significance. Now, interestingly, when they looked at in-class comparison of individual SSRIs receiving fluoxetine versus escitalopram, fluvoxamine, paroxetine, and sertraline, they found absolutely no difference. So there was no SSRI associated with a greater risk of type 2 diabetes than another SSRI. And what I like about this study is, given the likelihood that this kind of randomized controlled trial isn't likely to occur anytime soon, this real-world analysis is very valuable. But what I want to emphasize is that it's a very, very small association, and only in publicly insured but not privately insured children and adolescents treated with SSRIs and type 2 diabetes. It appears to be less than was previously suggested, and it's different than a cause and effect relationship. What do I mean by that? Well, to find an association can be of interest, but it's a big step away from a cause and effect relationship. One example I like to give to students when I teach our psychopharmacology course here is that if, for example, when I talk with the students for the 12-week psychopharmacology class, let's say every single time I talk with them, it rains. Well, there could be an association with my talking with the students and there being rain that day. However, it's a big stretch to say that because I talked with students teaching psychopharmacology, that caused it to rain on all of those days. So there's no cause and effect caused. And when we looked at the difference between the small, statistically significant increased risk in privately insured children, but not publicly insured children, that raises question for their health at baseline? What are other factors that could be involved and increase the risk rather than just SSRI? Bottom line here is this study still raises far more questions than it answers. It does not mean that we should not use or prescribe SSRIs in youth, but it is something to keep in mind when we individualize treatment and to consider metabolic changes in those children and adolescents treated with SSRIs. So a small, likely not very common risk, but one to keep on file and in mind.